In this lecture, we're going to dissect the muscles of the back. And you can see there's a lot of connective tissue along the back. So you and a partner are going to have to really work at removing some of this connective tissue. You can see it's a different type of connective tissue. It should be flimsy, consistency of wet toilet paper. What you want to be careful is not picking at the muscles. Muscles are going to be brown. This is really important that you begin to look at the striation patterns, right? Maybe a little pull. If you pull, you can kind of see where connective tissue meets muscle. That's where you want to cut, or that's where you want to remove. So you're actually going to spend a little time removing connective tissue before you can actually begin the dissection. So you can see that I have quite a bit. So these are the muscles of the back in this area right here. And then in another video, I'm going to show you the muscles of the shoulder. Again, I'll have to remove connective tissue. In terms of connective tissue, there are two types of connective tissue, or two areas of connective tissue that you cannot remove. And that's the area by the shoulders that's in the middle of the back. And then there's the lower back. This is a tough fibrous connective tissue, and this connective tissue actually attaches the back muscles to the back. So if you remove this center tough fibrous connective tissue, your muscles will now become a flap moving from the middle of the body to the lateral side of the body, and we do not want that. You do not want that at all. So take a little bit of time removing the connective tissue, and as soon as I'm done, I will come back. So I've removed as much of the surface connective tissue as I could, and you can see there's still some more in there. But these were the two connective tissues that you needed to keep intact. This one right here, this tough fibrous connective tissue, which connects these two muscles, two back muscles, and it connects the muscles to the back, along with this triangular shaped tendon sheath right here, which connects the latissimus dorsi to the back. So those ones you had to keep intact. So now we can begin the dissection of the back muscles. So the first muscle that we're going to dissect is this muscle right here, this big one. It's called the latissimus dorsi. And what you're going to do is basically you're going to dissect it on one side. And the side that you're going to dissect it on is the side closest to the abdomen. So you can see if I give a little tug on the connective tissue, there is the boundary between connective tissue and the muscle itself. And that's where you want to begin picking the connective tissue. You're going to be using scissors for this dissection. And that's because the connective tissue is just so much that it's just easier to cut the connective tissue. Where the connective tissue meets the muscle, it's just easier to cut, like I just did right there. So here's the muscle, here's the connective tissue that was attached to the muscle. And again, I'm going to try to create a pocket like I did with the skin. Just get my finger in there, right, and separate the latissimus dorsi from the deeper back muscles, right? So you can see there's muscle, latissimus dorsi, here's connective tissue. So I'm actually going to use my scissors and cut that off as well. Remember, small snips. Okay, and we have just separated latissimus dorsi. Okay, so there's the latissimus dorsi. So the next muscle sits on top of latissimus dorsi, and it's this triangular shaped muscle here called the spinotrapezius. Right? So in order to get to the spinotrapezius, we actually have to, again, look for a line of demarcation, which is going to be here. And this is the boundary between the spinotrapezius and the latissimus dorsi. And I see this line right here, and I'm going to carefully just pick at this connective tissue. The spinotrapezius is going to be a flat muscle, very flimsy, so you have to be careful when you dissect it out. You don't want to rip it by mistake. So I'm just picking out the connective tissue. I'm going to try to find a pocket. And once I find that pocket, I'm going to kind of do the push-pull method like I did with skinning to separate. So if you notice, when I pull up on the spinotrapezius, right, I can see more connective tissue where it connects the spinotrapezius to the latissimus dorsi. So I'm just going to pick at that, right, and I'm just going to keep doing that until I can't do it anymore. right? So lift and pick, lift and pick. So now I think I have enough of a pocket. Get the butt end of my forceps or the tip of the dull probe, and I'm just going to kind of move connective tissue away. There's still connective tissue up here. Let's see if we can lift this. So here's the boundary here. Pick at that. So now I'm going to pull up on the spinal trapezius, push down on the latissimus dorsi, and now you can clearly see one edge, right? One edge of the spinal trapezius. So again, the spinal trapezius looks like a triangle. So here's the top part of it. Here's the one side of it, and then here's the other side. All right. Now, in terms of separation of the spinal trapezius, you're not going to do anything in this area here to separate this muscle, the spinal trapezius, from the acromial trapezius. You're not going to do that. And you're not going to separate the spinal trapezius from the back. So basically all you're doing is cleaning up connective tissue to define the borders between the muscles as best you can. You're not going to be removing or dissecting those muscles from one another. So pretty much the spinal trapezius is done in essence. So you can see here's the border, right? Here's the border between the spinal trapezius and the acromial trapezius. So the next muscle we have to dissect is the acromial trapezius, which resembles more of like this square or oval shaped muscle. And then the last one will be the clavotrapezius, which is going to be up here. And again, this is looks more like a triangle. So continuing on, I'm going to move some more connective tissue to help define the acromial trapezius. All right. So there is connective tissue above the acromial trapezius that sits right in this area, right here, that you are going to have to pick at and you are going to have to separate, because you can actually separate the acromial trapezius from the clavotrapezius. And there's this connective tissue that's holding it together. So I'm going to take a little bit of time here and I'm going to separate that right now. So I finished picking the connective tissue that connected the acromial trapezius to the clavotrapezius, and you can see now that the two muscles have been defined or separated from one another. Now this muscle here, you don't need to know, it's called the levator scapula, but because you removed the connective tissue between the clavotrapezius and the acromial trapezius, this muscle got separated or dissected out by default. So in order to see the rest of the acromial trapezius, again, you're just picking at surface connective tissue to define the border or the boundary of this muscle. So here is the border, the medial border of the acromial trapezius. Here's the inferior border of the acromial trapezius. Here's the lateral border of the acromial trapezius, and then here's the superior border of the acromial trapezius. So the acromial trapezius is this muscle right here. This is actually a shoulder muscle, which we'll talk about in a different video. This muscle right here is the clavotrapezius. So recapping the muscles of the back from the dissection, this is the latissimus dorsi. It's the big muscle. On top of the latissimus dorsi is the spinal trapezius, which is this triangular shaped muscle, followed by the acromial trapezius, which is more like a square. And then finally you have the clavotrapezius, which is up by the neck. And that concludes the dissection of the back muscles.